आ गया developmental milestones, rather developmental stones. You must be ready to face them. What is your answer, doctor?
D, sir. D.
Incisor teeth will take what age, doctor, for them to develop? Between
6 months.
5 to 7 months. Exactly.
Sir, A also, sir.
What is A?
Rollover.
Let us see. Rollover, you mean to say?
Yes, sir.
By the age of 4 months, most infants can roll over, except we asked, no?
Usually rollover is at 6 months, sir. 5 to 6.
Who told? Your grandma?
20 weeks, sir.
No, doctor. 4 months.
20 weeks.
Nowadays, babies are doing things little faster also. No, doctor. 4 months. Ye cheez to wrong nahi karna.
I didn't do wrong, sir, but it is a fact. A.
Yeah, you need to master. That's all about competition and fighting the edge, because developmental milestones are inevitable in exam. If we say I don't want to read, I don't like to read, I get nausea to read, still you need to read. There's no way. Now tell me, doctor, child of 10 months.
B.
C.
C.
You mean to say he can crawl symmetrically by dragging his extended legs behind using his forearms?
8 months, sir.
Appropriate for a child of 10 months.
C, sir.
Symmetrical forward parachute reaction by 10 months. Good finger thumb opposition. Crawl without dragging his legs and have a symmetrical parachute reaction. Okay, doctor. If you do this mistake, still no problem. 3 weeks is too much a time. Today only tear those pages of Ghai and then tuck it in your pocket when you go to exams. Do something. 90% of children at 1 year, they can do any of these except
A.
building tower of 3 cubes and apartments. For a time lagta. So, well developed pincer grasp, give up a toy on request, show anxiety towards strangers, and before the age of 18 they can't build 3 cube towers. They cannot walk without support until the age of 15 months. Walking is different by the first 1 or 2 on the first birthday, no. First birthday they are supposed to demonstrate to the entire public who come for the birthday party that they are capable of putting 1 or 2 steps and fall down. But don't put the poor kids in so much pressure. They can't walk until 15 also. Ultimately they will get seat in MD. So that is an important thing. Obese 8-year-old, what will you see? Greater than average height is what you typically come across. So I leave to you obesity. What are the changes? Common question asked in the exam is chronological age, bone age, discrepancies. Today only you should read. In which case, which is more accelerated, etc., etc. Everything about it. What is wrong about measles vaccine? Why do you postpone to give the measles vaccine until the 9th month? Basically, it is affected in its efficacy by the antibodies that a newborn baby will have, which he received from the mother across placenta. Intussusception. What is the importance of it, doctor?
Sir, in the previous question, what about C, sir?
C,
Option
sir.
C.
What about C?
C.
There are enough number of studies to show. So we give it 9 months. If you give it 15 months, it is supposed to provide the protection better. So that makes it because once more of the maternally derived measles antibodies. Intussusception in childhood. In Gulbarga, is it broadcasting? That was done. Okay. What is your answer, doctor? Intussusception in childhood?
B, sir. Sir, B.
Is it the earliest sign the passage of red current stools? Blood and mucus are the late signs, and in a good number they may not appear at all. That is the basic difference. Central umbilical hernia in a 4-month-old infant.
Reassurance.
Huh?
D.
Reassurance to the mother. A good number of times it is recoverable. Acute bronchiolitis may what will happen, doctor?
A. Obstruction.
Why lung volume increase?
Obstruction.
Basically bronchiolitis may there is a recruitment of respiratory muscles in an attempt to open the obstructed airways. Right? When you recruit more number of airways, when the muscle activity increases to breathe, that will cause a extremely negative intrapleural pressure, and that will increase the transpulmonary pressure, and that in turn will increase the total lung volume in case of the acute bronchiolitis pathophysiology. Right ventricular hypertrophy is not a feature of
Tricuspid atresia. C.
Typically not tricuspid atresia. Tricuspid atresia means there is no blood going to right ventricle at all. Then PDA 2-year-old. What is true? PDA obviously ASD, PDA, VSD. In all these conditions, left blood goes to right side and more blood flow to the right. And that increased pulmonary plethora ultimately will lead to pulmonary hypertension, leading to reversal of shunt. Is in Minga.
Sir,
Now,
B.
huh?
B. Option B.
What about B? Prostaglandins maintain patency. Patency. Patient. Somewhere it was explained. We'll come back on that indomethacin funda. All right. Patient. No, the point is giving indomethacin is not a permanent solution. Even at second year it didn't close means surgical repair is what you need to basically carry on. That's the point. Tin tack sign, carpet truck sign.
DLE.
DLE. Excellent. Now, where do you see best prognosis? What was your honest answer?
Endemic. D.
Huh?
Endemic.
Endemic.
Endemic type pemphigus you thought, eh? Once more, common sense. Why neonatal pemphigus occur? मदर का pemphigus वाला antibodies fetus को transfer होने की वजह से. Fundamentally, fetus doesn't have any pathological problem, so it has got the best prognosis. Herpes gestationalis is not due to herpes virus. If you know that, you answer this question. Typically, previous pregnancy with pemphigoid gestationalis, HLA, etc., are the ones which predispose to herpes gestationalis. Herpes always is a disgusting topic. There is one herpes simplex, there is one herpes zoster, which are not same. On the top there is one herpes gestationalis. There is, if you get fever or any stressful factor, herpes become precipitated. Different forms of herpes, you must know which is viral, which is not. Now doctor, plaque psoriasis may try your lucky HLA number.
A.
Yes, sir.
CW6.
Yes.
Popular wrong answer.
Yeah.
C you thought, eh? B you thought. Oh, CW6. It's not in your hand. 8 to 10 conditions HLAs commonly asked, you have to remember. Nail psoriasis में most characteristic is what? Most बोलना.
C. I wrote C.
You thought C है? संबंगल hyper असल पहले वो psoriasis में होता क्या?
Yes, sir.
होता? अच्छा. But oil drop sign. Oil drop sign most characteristic. Tracheal tube, you are unable to advance into trachea, doctor. What will you do? That's what. Will you apply extra pressure on the larynx?
No.
That is Selleck's maneuver, which is done in pregnancy to prevent aspiration, which is called as Mendelssohn syndrome. You will not place the head in a chin-up position. Already you are unable to negotiate ET tube. On the top, if you head up the chin.
Sir, C is also same one. No,
C, sir.
Elevation of
C.
mandible.
Chin-up position is not elevation of mandible. Chin is different from mandible, no? You elevate mandible, you will open up the ET tube's entrance. You elevate the chin, you will narrow it down. Alright, doctor. There is a difference between preparing chicken 65 and chicken biryani. So both are chicken. So maximum depression of cardiac output.
Halothane.
What's your confident answer? Halothane. Asthmatics, what is the best choice?
Halothane.
Halothane. Which is not metabolized in liver? N2O is not metabolized. Post-operative nausea, vomiting. These are all straightforward
Ether.
quiz questions.
C.
B.
Ether. Ether. Dusky purplish cast to the face with telangiectasia. One of our forensic professors used to have this.
Benzodiazepine.
He used to get the alcohol very freely. So he comes to class like the Kamal Hassan movie. Drink a little, put it, okay, today for 30 years class is there, he used to come to class. So what is your answer, doctor? Alcohol abuse may dusky purplish cast on the face is what you typically come across.
One not.
Type A personality का मतलब क्या होता है?
D.
Ambitious guys. Type A. So they have an urgency of time because they find life is too short. It is not waiting on the Goa beach for the next wave to come. Not that kind of guys. Type A is ambitious guys. Ecolalia is recognized feature of, that is like a parrot
Except, sir.
repeating, yeah, except
OCD.
OCD. OCD and echolalia are not related, but catatonic schizophrenia, Alzheimer's, autism, etc. Involuntary parrot-like repetition of the words spoken by the others is what you typically come across. Delusions are not a feature of which entity in psychiatry?
Anxiety.
Anxiety.
Beautiful. Mania, schizophrenia, dementia. In any of these things, delusions can be a component. So delusion, illusion, hallucination, you must know all the differences of definitions, everything. What is rabbit syndrome? Have you seen how the rabbit will be fluttering its mouth? So, what is that? What was your wrong answer?
B.
Find rapid repetitive movement of the lips. Very good. So, what is akathisia? Some of our classmates in the reading room will have. They will never sit in one place. Irresistible urge to move around. Automatism. Non-reflex acts without conscious volition. Some more of our classmates will also be automatic. Mannerism. Doing the same mistakes which you did in AIMS exam once more in PGI. So, now, HRCT in ABPA, what are the classical features?
C.
Central bracket.
Typically, central bronchiectasis is hallmark radiologically for ABPA. Honeycomb appearance in lower zones is the important point in this question. There is one dirty book called, have you heard Chapman's Radiology Differential Diagnosis? Reading that book has removed our taste for taking radiology. मतलब जिंदगी तमाम बुक देख के डायग्नोसिस बोलना बोले तो उसमें कौन सा कंडीशन हो सकता? Tomorrow as a radiologist, what will you do? It can be TB, it can be lymphoma, it can be Metastasis, it can be anything, correlate clinically. So, that is the whole tragedy. So, we thought living with the shadows is an impossible job, especially when you love to sit along with the patients. Everybody's story is a movie. So, you have 100 movies with 100 OPD. So, life is much more enjoyable with the people around. Not always. So, doctor, what is your answer? Rheumatoid lung. But ultimately, radiologist brings those finest clues to the diagnosis a good number of times. Rheumatoid fibrosis, predominantly basal changes is what you need to appreciate. All the remaining were all upper lobes. So, upper lobe lung zone preference, lower lung zone preference I have given, doctor. Still in your brain some space, if it is left to remember, pack the facts right. Now, what is the eponymous name for extra-articular fracture of the distal radius with volar subluxation of the distal fragment?
Smith.
Huh? What is it called? Smith's fracture. Beautiful. Eccentrically placed non-sclerotic margin containing lesion which is abutting into the articular surface. Classical of giant cell tumor.
Sir, aneurysmal bone cyst.
You thought tibia may ho sakta.
Eccentric lytic.
All these things being satisfied doesn't go with aneurysmal bone cyst. I think something to do with sclerosis, I believe. Just you recheck that. Now, which finding says it is benign? Hampton's line. Very good. 60-year-old undergoes colectomy. What is the best antibiotic you want to give, doctor? Cefotaxime and metronidazole, because metronidazole gives the anaerobic coverage. How much is
350 ml.
Similarly, you must also know how much is a large whiskey. What is meant by small whiskey? Small means 30 ml. Large means 60 ml. You will prepare very well to the banquet of MD entrance. He will give it in ounces. You must know how to convert ounces into ml. Life is miserable sometimes. Each ounce has how many ml? Who will give me the answer? Kitna? Check that. I don't know. But our examiner, MD final exam mein, you tell एक large whiskey में कितना मिलेगा, I will pass you. So you will feel suddenly इतने साल पढ़ के whiskey के वजह से खो गया MD. So ML matters. Similarly, a lot of questions are asked on how much pleural effusion will be visible, how much acidic fluid to it become visible. All those ML based questions you need to be sure. 1 ounce is 30 ml Google info. Then that becomes a small 30 ml or 3 ml? 30 ml. Oh, 30 ml is called small. 60 ml is called large. Now, dextron, if you give, what is least likely?
Hepatotoxicity.
Hepatopathy doesn't occur, but coagulopathy, nephropathy will occur. So, simple dextron, how will it cause nephropathy? It causes, we can't help it. Then, because they are large molecular weight compounds, they increase the osmotic pressure of the plasma, and that brings all the problems of nephropathy and also coagulopathy, where it interferes with the clotting factor function. Now, jejunostomy feeding. What is the commonest complication, doctor? Diarrhea. Any day. Surgical sutures. I am telling you, doctor. Absorbable sutures, non-absorbable sutures. All that list. आज ही जाके बट्टी मारना. Definitely one question will come. Recent COVID ke also it came, no? One of the sutures. So 10 by O suture is a thin one or a thick one? 10 by O is very fine. What about D? The reverse of that is true. Skin staplers, there is a funda in this. Do we use a linear stapler for the skin or not is the issue. I think D requires some recheck on that. D. Cystosoma versus fasciola. What is the difference? Cystosoma enters to skin. Fasciola comes when you eat it. Highest risk of malignant change? Erythroplakia. Then parotid cuff stones, what do you want to do with them?
Surgery.
Basically, you need to surgically remove them. Early glottic cancer, how do you treat?
Radiotherapy.
Radiotherapy. Tertiary hyperparathyroidism का मतलब क्या होता है? Primary hyperparathyroidism means parathyroid adenoma. Secondary hyperparathyroidism means if you have a renal failure, if the vitamin D is low, hypercalcemia will be there, that stimulates the parathyroid gland, that becomes secondary. But if you remove those parathyroids, if you treated the renal disease by transplantation, still parathyroid continues its old habits, that become tertiary, where it has become autonomic. Then most common benign lung lesion will be which one? Hematoma, pulmonary hematomas, which require excision. Which is not true about primary lymphedema. What you thought is answer, doctor?
Adenoma.
TB you thought?
Adenoma.
But most commons are always obnoxious. Now, primary lymphedema. Lymphedema में 3 varieties रहता doctor. Primary lymphedema, lymphedema congenita, lymphedema tarda, lymphedema precox. You must know the differences. Lymphedema congenita, more common in males, typically bilateral, affects the whole leg. I don't know how you will remember, but precox, more common in females, typically unilateral and only reaches the knee. Right? And lymphedema tarda, obese individuals will have it with lymph nodes replaced by fibrofatty tissue. Somehow you make some effort to read, there is no guarantee it will come or not in exam. So that is the whole problem. Now, which contrast is safest if you are suspecting esophageal perforation? Still you can give that contrast.
Barium.
Any day, barium is not harmful, even if perforation is there. T stage of gastric cancer depends upon the
Ultrasound. Endoscopic
depth of invasion, which can be made by
endoscopic ultrasound.
endoscopic ultrasound.
This is more
MRI can't make that sensitively as endoscopic ultrasound. It is much more sensitivity way. Then difflois lesion is fundamentally a gastric arteriovenous malformation and a hematoma that typically lead to hematemesis is what you need to basically remember. Then which is a pathological entity rather than an anatomical anomaly?
B. Absent cystic.
Obviously absent cystic duct. Absent cystic duct will cause the stones that impact in the neck of the gallbladder, which ultimately will erode the cystic duct. Then of the various local complications,
B.
when will you operate?
Infected necrosis.
So based on the CT, there is a grading, less than 1/3, 1/3 to 2/3, more than 2/3. How much necrosis is there in the pancreas? Based on CT we grade. Based on the grading we will take a call whether to do surgery or not. So the presence of pseudocyst or pleural effusion or acute fluid collection, they don't mandate surgery. But significant necrosis mandates surgery. is the important point to carry home. Non-specific mesenteric retinitis versus tubercular retinitis. How do you differentiate?
D.
Shifting dullness.
Basically, it does not require laparotomy. It is commoner than tubercular mesenteric retinitis, and it is common in the children compared to adults. They are all the true statements about it. Jejunal diverticulae, what is least likely feature out of all this? What is your answer?
D.
Huh?
D.
D you thought that?
tissue.
That's good. Basically, diverticulae in jejunae is a common finding in those who are having connective tissue disorders. Okay, doctor? Unlike Meckel's diverticulum, etc., where you have ectopic gastric mucosal tissue, in this jejunal diverticulae there is no such ectopic gastric mucosal tissue, so they don't lead to bleeding. Surgery in ulcerative colitis you won't do for, by itself it is not an indication.
A. Extraintestinal manifestation.
If you happen to do surgery, then it will bring the remission, and also the extraintestinal also will be helped out.
But it is less significant compared to other three indications, sir.
Pancolitis is not by itself an indication for doing the surgery, is an important point. For steroid dependent state, or if there is a severe hemorrhage, or if there is extraintestinal manifestations, if you do surgery and remove that inflamed bowel, then that will bring remission, but not for pancolitis. Lot of people will have pancolitis with inflammatory bowel disease. You don't end up in doing surgery. Since we can't medically manage them anymore, we try to surgically manage. That's what steroid dependent disease if it is. Further, you can't medically manage them. So in such scenario, in order to make them to not receive steroids anymore, we do the surgery. It's an indication.
Sir, pancolitis has greater chance of malignancy, sir.
That is pathophysiologically anything is possible, but it does not form the indication. That's the point. 65-year-old, once more, these things are all common sense. If your common sense worked out, you will correctly answer. You won't expect them, remember them and go and face an exam. But how much ppm chloride is there now? That you should expect, you should not guess, you should use coriquina and correctly answer an exam. Be very sure. And lipid profile based question, don't blame Harrison, doesn't carry it. Harrison is fully pregnant with only lipid profile guidelines only. If you missed it means, array, what doctor? Huh? It's like telling a 9th month gestation pregnant female that you only have little obesity, go home. So now 65-year-old with iron deficiency anemia.
A.
No obstructive symptoms. Yeah, what is your answer?
A.
So fundamentally, how will right colon versus left colon differ? Left colonic lesions will be annular obstructing. Right colonic lesions will be ulcerating and bleeding. So that's how you differentiate the colonic malignancies. So from tomorrow we have the anatomy session starting, doctor, evening 5 to 8. Every day you will have about 150 MCQs on a given topic, upper limb one day, lower limb one day, like that. 100 MCQs are given as a quiz. So 250 questions become discussed. So 10 days may around nearly around some 2000 questions are reviewed, covering all the components. So you can log in sitting in the home, or you, if you don't have internet, come down to our center, and we have Dr. Muralidhar Reddy sir, excellent teacher. You can also tell your juniors. So he will be covering it. Then following anatomy we have physiology, which will be in the session. So this year we are going to conduct 30 weeks program, and last year we conducted theory based reviews. This year once more we will conduct a MCQ based review. Every day 200-250 MCQs, and based on that we cover all the concepts. So, doctor, after surgery, a little gas into the diaphragm is a common finding which should not indicate you for any bad omen. Hydrocele is a collection in basically process vaginalis. Incompletely descended testis in a newborn male. What is your protocol?
C.
Will descend in more than a third of the cases in a period of about 1 month. In fact, 30% of preterm babies will be carrying an undescended testis. 4% of the term babies will have undescended testis. Nothing to worry about. TURP, what will you use?
A.
Glycerin.
Typically, it is the isotonic glycine, 1.5% isotonic glycine. Vesicovasal fistulae are often due to
Obstetric trauma.
obstetrical trauma. Ectopia vesicae, what is it because of basically? Underlying pathophysiological, embryological theory. It is the delayed rupture, not early, delayed rupture of the cloacal membrane, which is responsible for the ectopia vesicae. Superior inferior vesical arteries, where will they originate, doctor?
A. Anterior trunk.
Anterior trunk of the internal iliac artery. Celiac axis, aorta, branches. One question commonly comes. Now, uretary coli, what is not a true statement? What do you like to say, doctor? Basically, strangury is not only a problem of men. That's a problem that is seen equally in either sex. All the remaining statements are true. Now, right hypochondrium में pain है, doctor. When you have evaluated, you found a cyst in the kidney. What do you want to do? That won't explain the right hypochondriac pain. So, do you need to immediately do something on the simple cyst of the kidney? Lot of people will have. Even president of a country can, if you do ultrasound, you may find nothing need to be done. Now, doctor, multiple ossification centers. Where do you see? I'll try to run fast. Classical of Downs, even leukemia, lymphoma, etc., etc. Soft tissue calcification without hypercalcemia. Where is you see, doctor, in all these other entities, hypoparathyroidism, pseudo hypoparathyroidism, etc., etc. And renal osteodystrophy, do you find hypercalcemia? No. You find hypercalcemia because the secondary hyperparathyroidism, what will happen at most? Normocalcemia it will be. And renal failure, one more thing, phosphate will be excess. That also will be sequestering the calcium, preventing calcium levels to get elevated. Now, chondrosarcoma versus chondroblastoma. How do you differentiate?
A.
Yes.
Basically, chondroblastoma lesion is in the epi and metaphysis of the proximal humerus. Chondrosarcoma is not like that. So, it is central and metaphyseal. That's how you differentiate. Bony ankylosis,
A.
typically in case of the pyogenic arthritis. Then intradiscal pressure will be lowest in which position of our living?
Supine.
If you lie down. Simple common sense. Back pain treatment is first lie down. If it doesn't resolve, we will think about cancer. That's what, don't tell like that to the patient. So, osteogenesis imperfecta closely resembles hypophosphatemia because there is a fragility of the bones, etc., etc.
Answer is given wrong.
Ring finger infection में कहाँ जाएगा? Mid palmar space is in direct continuity. You must know the boundaries of it. Osteoporosis में what will you not see, doctor? What is except about it?
None.
Pseudofractures are a feature of
Malaysia.
Malaysia. So Malaysia.
But here also, yeah,
Huh?
it can be seen in porosis also, sir.
What? Pseudofractures. Pseudofractures are more often feature of lack of mineralization, not due to the matrix problem, as what you see in porosis. And also in porosis. Then hyperparathyroidism ultimately will dissolve the matrix and lead to the development of loss of lamina dura. Left monoarticular knee pain, 18-year-old boy.
Readers.
Then what are the causes of monoarticular, polyarticular? You must be quite sure, doc. Now, Workman's pain, what is commonly involved?
FD.
Typically, profundus.